This is for the pathophysiology part. Again, very, very briefly, is that you have to make a summary for every disease. That's very short. And you have to follow a schematic like this. This is what you will be asked in the exam, okay? Definition, risk factors, causes, pathomechanisms, signs and symptoms, and finally complications, okay? And you go with this plan with every disease. So that's in general. Now let's talk about requirement-wise. For requirements, again, the first semester, you have lectures which are optional to be presented in. Doesn't affect pretty much anything. However, if you attend them, and correct me guys if I'm wrong, if you attend them, you will be exempted from an entrance exam if you attend all the lectures. But you will still have the oral exam. Okay, I think that was the last anyway, and then you have midterms. Midterms, you have 3 midterms. Two midterms are going to be just lecture related, and 1 ECG exam. So that's the thing. And as you can see, it's written here, the weeks, you have week 7 and week 13. And again, these midterm exams, they still consist of an ECG question. So you will have ECG questions in them, but they do not represent the majority of the exam. Moving on to the ECG exam, this is a dedicated ECG exam, which is going to be on week 10. You will have it in the TIC library, and this is going to be full ECG exam. It's going to be multiple questions, and it's going to be having ECG analysis as multiple questions as well. And I think you have 5 ECG analysis or 6, something like that, as a multiple choice question. Like you have the ECG and you have multiple choice. And if you achieve an average grade in these MTOs, a 4 or 5, this will be offered as your in-semester grade, and you are exempted from taking an oral exam, okay? So this is very, very important to understand. So just go for it, I think. And then the semifinal, how it works is basically it's an oral exam, and this oral exam is having an ECG topic in the beginning, and there's so many. So the semifinal, as I've mentioned, it's going to be oral, and it's going to be having an ECG topic in the beginning, and then 2 theoretical topics. And it's divided in the following fashion. The first 7 lectures of the semester are going to be, you're going to choose 1 topic from them, and then the second 7 lectures, you're going to choose another topic from it. That's how it works. And the entrance of the semifinal is going to be written. It's going to be 30 minutes, and it's just 10 essay questions where you either list or define some things, define a definition of a disease, or list some things. Like for example, like what are the signs of inflammation, for example, and you have to list them, robor, calor, dolor, etc. So this is the concept. Now for the second semester, you have 2 midterms, again, week 7, week 13, and they consist of ECG questions as well. And this time, for the second semester, it's going to be a little bit different because your average is going to be in competition with all the students in the university. So only the students that have the highest grade, the highest 20 percentile of students between the Hungarian, English, and German programs who are having the highest 20th percentile of these as an average in their MTOs will be exempted from the written part of the oral exam toward the second semester. And then the entrance of the final is going to be 10 essay questions. Again, the same formula, where you list or define. And of course, there is in the second semester, there is an ECG competition. And this ECG competition is different than the exam because an ECG competition is going to be a full analysis where you write by your hand in a methodical manner the what you see, what is the diagnosis of this ECG. And in this ECG competition, it's two ECGs. And each ECG you have to fully analyze. That's the process. And you have to get the diagnosis of this analysis. And keep in mind that in these ECGs, there are multiple diagnoses. So that's the thing. It's not just one thing. Like, for example, it's not just EV block, like, for example, first degree EV block. No, it can be first degree EV block with bundle branch block within the same ECG. So you have to be vigilant and pick things up very active. So I think that covers it for the requirements. Now, what about the resources? Resources wise, lecture material. That's what I want to tell you. Just lecture material, stick to the lecture material, memorize the lecture material as best as possible. If you do not understand, and that's understandable, because the lecture material is written in a literature form, like it's very rigid and strict. But what you can do is just use additional resources just to enhance your understanding, and that is Boards and Beyonds, Osmosis, Pathoma, websites, UpToDate, Medscape, Ambos, Robbins, even the Strike Force notes. But what I highly recommend you, and what they focus on, and what they want to hear from you is not Osmosis, is not Pathoma. They just want to hear lecture material. That's it. For the teachers, they will be annoyed if you say things out of the lecture material. So I highly prefer to you stick to the lecture material. That's the thing. Again, study path, read the lecture, read the additional resources, check the detailed topic list. Did I cover it? Did I not? Use videos to enhance your knowledge, and just study the lecture again. Memorize the lecture as best as possible. That's the goal. And again, here's the ECG, just to show you what to expect, how to handle this part of pathophysiology. It's very important. Again, ECG analysis, I'm not going to go into details here, just you have the basics, which you've learned from physiology. You're just going to refresh your knowledge on this thing and then learn the pathology of this ECG. And how to do it is that you have diagnostic criteria. You have to follow it step by step so you don't get lost. And this will give you a diagnosis. Once you write the diagnosis, okay, I have first degree EV block, let's say, write the mechanism, what is happening in first degree, right? Write in the causes of first degree EV block, like what causes of first degree EV block, and what type of complications of first degree. So this is very useful. This slide right here is very useful for your ECG competition. It's very useful for your ECG competition, so you can use this very thoroughly. And again, just use it methodically. Work step by step. Diagnostic, diagnosis, mechanism, causes, complication. So you don't get lost. And this applies for every ECG part. So remember. Again, first semester we've already covered this, so I'm not gonna recover it. Again, you have first semester dedicated ECG exam on your 10th week, and it's gonna have some scattered questions as part of your midterms, and it's going to be your first topic in the semifinal exam for the first semester. Second semester is gonna be again part of the midterm. It has a dedicated ECG competition, and you have part of the final exam, which is going to be the first topic from a total of 4 topics. No, actually, 5 topics in total. So you have one ECG topic and you have 4 pathophysiology topics in the second semester for the final semester. The resources for ECG, it's the ECG guide from the. That's it. And the ECG videos from the. I think they are very useful, really good. I wouldn't say they are the best. Okay, I wouldn't say they are the best. So that's why you can use live in the fast lane. It's really useful. And they picked ECGs from it. So in the ECG competition or in your ECG exam, they pick some ECGs from this website as well. Other books they have ECG Made Easy. I like I barely use this book, but what I mainly use, me personally, is the ECG guide, ECG videos provided by the department, and the website live in the fast lane for doing ECGs. Just practice ECG. And again, guys, just practice. That's the key here. Just keep practicing and revising. Study path, same concept again. So I'm not going to review myself. I will leave Nasser for microbiology.
Thank you very much, Osama. So with microbiology, most of the people are just going for like forgetting about it and just doing pathology and doing pathophysiology, which is one of the biggest mistake that you can do in both semester, first semester and second semester. What I recommend you to do is just yes, for sure, put some time for pathology and pathophys because it's a lot of topic to talk about and a lot of topic to study. But for microbiology, you just need 1 day. 1 day a week is more than enough. Because if you just leave it, it's gonna accumulate. And what you need to know in microbiology, as you can see in this table, for example, you have Staphylococcus aureus, which is the most important bacteria, and this is the first one you're gonna take. What you need to know about it is just the common characteristic. And this is the same for any bacteria. You need to know whether it's gram-positive or gram-negative, the enzymes that it contains, like coagulase positive, catalase positive, and whatever. And also the nutrient or the medium where it grows. Because there are specific medium that are really special. Let's just say Legionella. Legionella, it has the BCYE in the agar. And everybody knows that. So like these information, like these knowledge, you need to know. Okay? For the virulent factors, of course, these are the factors that gives the bacteria the ability to infect. There's hundreds of them. There's not like 1 or 2 or 3. There's like 30 sometimes. But you don't need to know all of them. You just need to know the most important ones. We just mentioned here like toxic shock syndrome toxin. This is for Staph aureus. Coagulase, some bacteria as well have it, and so on. You don't need to know everything because you will see 30 pages, 20 pages just talking about virulent factors, and you don't need to know anybody. For the diseases, that's the most important, and you need to consider this part of microbiology. This is what they want you to know about microbiology is the disease. You need to know just the definition of it. You just need to know some symptoms related to it, and that's it. And even not even sometimes symptoms, just need to know just to say the name and that's it. So don't worry about it. But at least you need to know the disease of each bacteria. That's really important. That's basics of any bacteria, or even viruses in the next semester. For the treatments, there's multiple as well. However, there are some, I think, bold antibiotics that is mentioned in the lectures. That's what you need to know. The rest, I don't think you need to know. I don't think you need to worry about it at all. And yeah, just for example, Staphylococcus aureus, really important to know ampicillin, vancomycin, also methicillin for some strains, and that's it. That's the only medications, even though in the lectures it just says maybe 10 or 20 or something. So you don't need to know all of them. Just need the bold ones in the lecture. Go for the next slide. Okay, now for the requirements of the microbiology for the first semester, and I highly recommend everybody to attend the exam. I know maybe some of you will say that okay, pathology is hard, pathophysiology is hard, but just 1 day a week and you'll be fine and you'll get really good grades in the exam. And that's what I did, and it worked for me. So if it worked with me, it will work with you for sure. So in the lectures, if you attend, I think more than 80%, I think you can multiply it by the amount of the total lectures, and you can know what is the how many absences you can do. or you can make. And if you did this, they will give you some bonus points, which is really good. However, in the midterms, it's not compulsory, but again, I highly recommend to attend the exams. Really, really important, please, guys. Because even if you didn't get the exemption for the midterms, it's still going to help you to really just revise at the final. That's it. It's going to be 50 questions, 50 minutes. Most of the questions going to be some of it from past papers, but some of it is going to be just straightforward. It's not going to be hard at all. And it's just twice in the semester, 6th and 12th week. Anyways, that's not the most important part. The most important part, what I really always focus in any exam in third year, is the exemption, because it really helps. So, for example, here, if you get more than 70, the average of both exams, you get more than 70%, you're gonna get plus 3 points in the semifinal. However, if you get more than 80, you're gonna get an offered grade. And in my case, there's so many people who got offered grade. I was one of them. So please try as much as possible to get it. And even if you don't worry, it's gonna help you a lot in the final, because it's gonna be just revision, 1 week and you're good to go. Semi-final is going to be written again, 60 minutes, 60 questions, and there's no partial points. However, in the second semester, it's going to be a little bit different, because this time, I think the first exam is going to be in the 11th week, as I remember, for virology. Of course, it's not compulsory. However, if you get certain point, like above 70%, you can change the topic. If you get more than 90%, which is actually tough, but always try to do as much as possible. Try to put the aim for more than 90%. Even if you don't get it, it's okay. At least you studied for it. And you're going to get exempted above 90%. The lectures, sorry, I didn't talk about the lectures. Yeah, as usual, optional. If you attend more than 80%, you can change the topic, any topic you want. And I think I remember that you can also, even if you didn't like the other topic that you changed, you can go back to the original. So that's good. The second exam, which is going to be, I believe, in the last week 14, is going to be a practical exam. I remember it was on Friday, I believe so, in the morning. And it's going to be the whole practical material of both the first semester and the second semester. And it's actually really doable. There's a lot of people who actually did the practical exam and got the exemption. So please do it. I know it's in the future, but the future is really near. So just prepare for it. Above 70%, you're going to get offered a grade with 3. This is for the practical part only. Above 80, you're going to get 4. Above 90, you're going to get 5. And for the final, I know maybe some of you now read it. There is 6 topics for the people who didn't, let's just say, didn't get exempted from the virology or the practical. There'll be 2 practical topics and 4 theoretical topics. I know it's a lot, but trust me, guys, the examiners are really good. They don't ask really in depth like the lectures. You're going to see the lectures are going to be really detailed. They're not going to ask you all of this. They just want you to know the bacteria, the most common characteristic, and then the disease. That's the most important thing. And maybe some of the examiners, they focus about the medicine, like the medication that you give, and also vaccines if there is. That's it. Next topic, next slide. For the resources, please, guys, what I recommend you, when you put one day, let's just say you put Sunday to study microbiology. That's what I did. After you finish the lecture material, after you highlighted everything that is important and what is written in this slide, in this presentation, after that, there's some additional sources actually really helps. I know that it's written here, Boards and Beyond and YouTube, but to be honest, the most important additional resource is Sketchy. And I think you heard it from literally everybody and everyone in the third year. Sketchy is really important. Why Sketchy is important? Because it gives you a photo memory of each bacteria. And if you ask any people from the third year, let's just say about Staphylococcus aureus, which is the first bacteria, everybody remember that it's going to be, I don't know, Moses with some pyramids and some river in the side. These sketches and these drawings just help you to just remember by the photos. And it's really important. So I recommend to read the lectures and then jump into Sketchy. Really important. And then if you like to know what to say in the exam, or sometimes you're not sure whether you covered everything that the topic needs from you, then you can go for Strikeforce notes. Sometimes it gives you the based on the like the in order how to know the bacteria, the characteristic, and so on. That's really good. But again, sketchy, 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 guys. I cannot say it enough. It's the most important resource, really, after the lecture. Sometimes some people actually passed the final exam with only sketchy, and they got 4 and get 3. So it is doable with only sketchy. But for me, I always go for the lectures and then sketchy. In this way, you're gonna master microbiology. The next page. So as I said, read the lectures, see some notes if you want, as you wish, but then go for additional sources, as we said, sketchy. And then you can modify if the lecturer said something, if you got some, I don't know, from YouTube videos, write the notes on it because you don't want to go again back and see the videos. And then study again and again. Repetitively is really important. And just for microbiology, also for pathology, and also for pathophys, these subjects are important for 4th and 5th and 6th year. It's really important. This is really high yield. So I really recommend you guys to focus on these subjects. Maybe I know it's the only subject that you have. I understand that, but just focus on it, please, guys, because this is like literally there's so many topics that we are taking right now in 4th year. It just copy paste 3rd year, copy paste. The only difference just like clinical features, and that's it. And I think that's it for microbiology. I'm not sure if that's it. Yeah, okay. So for yeah, Boards and Beyond, there are some maps that can help you out just to organize your memorization, like what are the gram-positive bacteria in one side and what are the gram-negative bacteria in the other side. It's really useful just to have a quick scheme or photo memory for your exam, but it's up to you. This is all up to you. But as I said again and again, lectures sketchy, lectures sketchy, lectures sketchy, and that's it.
So, thank you so much for
And now for
passionately like presenting this. I really appreciate it. Hopefully
absolutely,
everyone,
absolutely.
yeah, thank you. So now let's talk about pathology with Nia.
Yeah, thank you to both of you. And I think don't have much time, so I will try to explain pathology part really quickly. So first of all, we know pathology is a clinical. We need it from 3rd year on. As a doctors, we will need it all the time. That we will study the macroscopic, so we will see the actual organ, and also microscopic histological features of the disease, what is wrong with it, and everything. It consists of lectures, autopsy and organ demonstration classes, and also histopathology classes. The next slide, please. And the lectures are optional, but I would recommend to people who would like to learn by listening. But other than that, and if you would like to, if you read the lecture and see that you don't understand something, maybe you can go and maybe you can attend and you can ask questions or listen to the lecture and understand. But overall, it's completely doable by yourself, and I think it's easy to understand the lectures. The midterms, there are 2 during 6th week and 11th, 12th week, sorry, in the library. It's a quiz-based test. There will be partial points, and it's needed to get average of 2 in both of them in order to take semifinal. But if you fail to do so and you will fail the both of them, you will have to take extra exam during the last week of the semester. And there is no exemption, but there is partial points. It's easier to pass, and I think if you take it as a first exam, you will most probably pass. It's easy to pass because of the partial points. But in the second semester, we have oral exam. The topic list, if you already saw, for the first semester, it will be now is divided into A and B. A being, I think, systemic, and then B, general. Systemic is similar to the physiology way they divide it into organ systems, and we study what's wrong and pathology of these systems. General, it consists of the most important part of it is the cancers, which is really important. They really care about cancers. Whether you get general or in systemic parts, they really care about cancers. So I will recommend to really study since the beginning and really pay attention to the cancer part so you understand it well. and you understand the mutation or whatever, like the mortality rate, when does it happen, in childhood or in adulthood, the survival rate, and mostly like details I would recommend to remember, because they may ask you during either autopsy exam, they can ask you anytime during classes. And so during the final exam in second semester, you will have 3 topics, 2 topics from systemic and 1 topic from general. And if you get, you will have 2 midterms as well. If you get average of 4 in midterms, you will have pre-autopsy exam, meaning you will take the autopsy exam during the last week of the semester. But if you get average of 4.5 of the 2, you will get also 1 topic exemption, 1 topic being out of the systemic. So you will get only 1 systemic and 1 general topic. And also you will have 1 histopathology exam. For us, it was pictures. Maybe they will upgrade the case viewer for you guys, and they will show you the slide, and you will have to identify first the epithelium and what is the organ and what is the disease. They may ask you about the disease as well, so you should be prepared for the histopathology part as well. The next one, please. So the lecture material, it is really, really important. You don't need anything else than really the lecture material. And case viewer, it is for the histopathology. You will sign in and you will see the slides themselves, and you can zoom in and see what's wrong and which was the dead tissue or anything. So what is wrong with the slide, you can see it on them. But boards and beyonds, it's really good as well as an additional source if you don't understand. Pathoma and osmosis as well. And notes, you can use it for autopsy. There are some notes that you can use, but that's for the second semester when you have the autopsy exam. Next, and I think that will be, so lectures is the most important. And when you start for the histology or any autopsy exam, please don't start with what is wrong, what is the wrong with the organ. Start with what is the organ, what is the epithelium, what do you see if it has a cancer, like you see a nodule, you see a different color, you see a changed epithelium, whatever you see, generally you should start talking about it, what is wrong with the organ. Please don't start with the disease. I know it's easy when you look at the lung and see emphysema that to say that it's emphysema, but first please start that it's okay. We see some nodules or we see the anthracosis or anything. Please, in the end, say the disease in the end, and also they may ask you additional questions about the disease. So plan. So try to identify the epithelium, as it says, the organ, and describe everything first before you say what's pathological for the organ. And yeah, like I said, you should define what is it generally that is written. Usually it's written in the beginning of the in the beginning of the text. And why does it happen? What's pathogenesis and morphology? How does the organ look when you look at it, and how is it when you see histopathologically on histology as well? And then consequences, the mortality rate, or is it incurable or curable, or anything else that is mentioned within the lectures you should mention. And I think, yeah, it's one of the examples. They changed the lectures, and there will be no more notes or lectures. There will be only one. So you will have pictures, and you will have histology pictures as well. And in the MTOs, you may see some of those pictures from the slide. Yeah, and this is case viewer. They will tell you most probably the password. It was for a student username and student password, but if they change it or something, they will let you know about it, and it's quite useful to see the slide if they fixed it.
All right, hello again, guys, ladies and gentlemen, in this beautiful event. So today we will continue right now. After we talked about pathology, pathophysiology, we talked about microbiology. Now we're finishing up with internal medicine and surgical orthopedics, and also pharmacology. So for internal medicine, again, here the lectures are optional, but if you attend and get more than 80% in the small test, at the end of the class, this will grant you 1 mark towards the final grade. So This means if you get a 2, you will get a 3. If you get a 3, you will get a 4, and so on. And there is no midterms. There's only semifinal, and the semifinal is going to be an oral exam. So that's for internal medicine. Again, the same system is going to be in the second semester. However, in the second semester, there can be an exemption, I remember. And that is if you get a 5 or more than 80%. This is for the second semester. But again, first semester, there's no exemption from internal medicine. You have to do a semifinal, which is the oral exam. And this oral exam is going to be having a practical part, which is going to be examining a patient. So the first 2 lectures are very important to successfully examine a patient. They want you to actively examine a patient and speaking their name. So remember that. It's very, very important. And then the second part is going to be just 2 theoretical topics from a topic list, and that's it. So that's for internal medicine. Moving on to surgical pre-diabetics, this one for the lecture, it's optional, okay? But if you attend and get more than 80% a small test, at the end of the class, there will be a lowering passing of the threshold from 60% to 55%. So you're pretty much gaining 5%. That's pretty much it. And the final is going to be a written test in the library for surgical pre-diabetics. And surgical pre-diabetic is going to be in the second semester of your 3rd year. Okay, it's not in the first semester, it's in the second semester. And that's it, the final is written test in the library. The lecture material is what is needed for this test, and that's pretty much it. There is no need for other sources. Okay. Now I will leave the mic to Nasser to tell us about pharmacology and pharmacotherapy.
Okay, so for pharmacology, which is next semester, what I want you guys is not to do, again, I don't know why am I assigned for the subjects that is the least important, but okay, it's all right. But it's really important, by the way, because the problem with with people is that in first semester, they don't focus about micro. Second semester, they don't focus about pharma, which is really, really not good. Sama, can you just close your microphone because it's just there's echo. Okay, so the problem is that people are just leaving pharma. And why is that a problem? Because you will carry it to the next semester, and next semester pharma, which is 4th year, first semester pharma, is going to be hell because there's a lot of drugs to know and there's a lot of drugs to memorize. So don't do that. Pharma is really simple. It's really easy. I know maybe some of you maybe will think that I'm talking just bullshit, but that's actually true. Pharmacology is really easy. What you need to know, what you need to do is just study the notes and just go back to the lectures just to see the drugs that you need to know for the exam, and that's it. And notes just cover each topic takes 1 page, and that's it. So you can literally study the exam material. Let's just say the first MTO, which is going to be, I think, in the 4th or 5th week. I'm not sure. You're gonna take it. You're gonna just study 1 day or 2 days for it, and that's it. That's more than enough. And what is important about pharmacology and to pass it easily, pass papers, because even sometimes the teachers themselves they say take from because we have 1 pool questions, 1 bank questions, and they take from it. So sometimes it repeats. So if you have the past papers and we will going to provide it for you, just study from them, not just memorize them, study the question, like to know what is the right answer, what is the wrong answer, why this is the right and why this is wrong. And it's going to be fine. You will easily get the exemption. The exemption simply, as you can see in this presentation, is going to be 3 exams. If you get an average, if you get more than 2.5 as an average, but there's one more thing about the first semester that you should not fail in one of the exams. So you need to get at least 2, and together all the exams and the average more than 2.5, you can get the offer grade. It could be 3, could be 4, or could be 5. But remember, you should not fail. I don't know if there's still there was questions in the lectures that you can do, and if you get certain points, they can give you increase about 10%. I don't know if it's still there, but if it's still there, that's really good one. Go for it, because sometimes it can increase you from fail to pass. So it's good. I don't know if it's still there. I'm not sure. It's not written in this presentation. Maybe it's removed. I don't know. However, in the end semester exam, I know nobody goes for an end semester exam, because you either finish pharmacology or you either carry it. That's the only choice you have, because it's really easy to pass it, really easy doable. It's going to be a written MCQs. Again, it's going to be from past papers. So really don't worry about it. Don't carry it. Do your best in it, and you will get it easily. With partial points, that's the maybe some of you will be a little bit like afraid about the negative points, but don't worry. So, and yeah, as you can see, this one correct choice equals 1, and one incorrect choice equals minus 1, 0.5. Yeah. And one more thing before I give the microphone to Osama to end it. Please, guys, just plan your week. Don't just study randomly. Plan your week. Put some days for patho, put some day for pathophys, and put some day for micro. Same thing for the second semester, including the pharma. You will be easily, you can do it all. Because we did it, you can do it as well. So don't worry. It's gonna be fine.
Thank you so much, really, for this intake. So pretty much, guys, like, thank you, Nasser, thank you, Nia, amazingly for this tremendous work that both of you did. It's amazing. And again, guys, we're making this Zoom meeting for a purpose. We want you to be the best. We don't want to waste your time at all. We really want to help you, and we genuinely intend to help you. So use this plan, use this study guide as a resource when you become lost, to reorient yourself pretty much, and make priorities. That's the thing. That's all about this university. It's all about time management and priorities. What is my priority? That's the thing. And one more thing I would highly recommend in this third year, please avoid electives. Like, electives will just confuse you and pretty much disorient you and make you focus on other things. There's plenty of time, plenty of room for your electives. Congratulations on those who are very dedicated and took many electives on your first 2 years. This year, just make it 4 compulsory subjects. Focus on them as much as possible. And now we are waiting for questions and answer. Any question, please, guys, throw it in the chat so we can answer it together. Let's see.
Any questions, guys? Any questions? Any.
We're open to answer.
Yeah. We are here to help you guys. That's it. We're not taking any money. We're not taking any money, I swear.
Exactly.
If you have any questions later, you can text me or Osama or Nasser, any of us. We will answer you. We will help you with all we can, really.
Yes.
So no questions. I don't see anything. Okay, we'll give them a minute. Maybe they're a little bit showing or something.
If you have any concern about specific subject, how to study for it, don't worry. Even if you're shy to say it now, you can ask us later in the private, no problem. But please ask, because we had experience, we had our mistakes, and we are here to teach people how to avoid it. And that's it.
I guess that's it. If there's no questions, there's nothing. Thank you guys so much for being here, for being part of this. We're really thankful, and it's our absolute pleasure to help all of you guys. Have an amazing night. Study well, study hard. You can do it. and see you in later meetings, hopefully. And thank you so much.
Thank you, guys.
Thank you. And good luck, guys.
Thank you.
Good luck, guys.
Good luck.
You can do it.
And good luck, really.